Good evening to all. On behalf of Uriel Kids, let me extend a warm welcome to all of you to episode 4 of Joy of Parenting. Today, we have with us Dr. Sudarshan Godkar, an expert in dermatology and who has a vast experience in pediatric dermatology, hair diseases, cosmetology, and has been practicing at Muktangan Skin and Hair Clinic, Kolhapur. He is also the Associate Professor in Skin at Government Medical College, Kolhapur, and is a member of different professional organizations. As part of his social endeavor, he has conducted social camps in different NGOs, schools, and government institutions. Welcome, Dr. Sudarshan Godkar, and thank you for giving your valuable time for our Joy of Parenting seminar, Skin Care for Young Children. Thank you very much. And I am Mrs. Yashashri More, who is the center head at Angels Paradise Academy, Preschool and Daycare, and also the content head at Uriel Kids Online School. We also have with us Mrs. Saili Bhosle, the founder and CEO of Uriel Kids. Before we go forward with the webinar, I would like to share with you a small video about what is Uriel Kids. So please, I will just share the video with you. Give me a second. So this is about Uriel Kids. Uriel Kids is India's first 24 by 7 online preschool where we are passionate about educating young minds to explore the world of knowledge and curiosity. It will be launched in UAE in April 2021, followed by in India. Your child can learn anywhere, anytime. Isn't that fun? It covers a broad spectrum of subjects like English, mathematics, general awareness, phonics, and many more things, which will ensure the holistic learning and development of the child. There will also be online after school activities conducted in the safety of your home. And these courses are designed by educationists with decades of global experience, and there will be live classes as well. As pioneers in early childhood education, we constantly bring together experts from different fields related to young children to fulfill our nation's goal of Fit India to Hit India. So, keeping that in mind, we have with us Dr. Sudarshan Gorkar, who is going to talk. We are going to have a interactive question and answer session talking about the skin care for young children. I'll be asking questions about the skin care from parents who have already registered for the webinar. And if you have any questions, please put it in the QA section of the Zoom, and we will be keeping a track on the questions, and they will be definitely answered by doctor. And one more small request, that for better reception, please can you keep your camera off, so that you will be able to understand and there will be no audio issues as well. So without much ado, let's start our interactive question and answer session with Dr. Sudarshan Gorkar on skincare for young children. Thank you, Dr. Gorkar, for giving your valuable time once again. So, there are some questions which our parents have already asked in advance. It's like you always ignore skin related issues in children, saying it is part of growing up. Would you agree with that, or what would you say to such parents? That how do you guide such parents?
So first of all, I like to thank Uriel for giving this opportunity. And yes, some changes are there in the skin as we grow up from infant to baby into a kid, toddler, like that. But actually, you should not ignore any of the change that is taking place in the child's body, and you should immediately get a consultation done by a qualified dermatologist, so that if anything is wrong or any disease is developing, then we can arrest it at much basic level, and we can treat it effectively. Because once the disease goes out of hand, then becomes difficult for treatment. So when we arrest it at earlier stage, then it becomes easy if any disease is there. Otherwise, your doctor will tell you that it is a physiological thing and you should not worry about. So you can leave that matter aside. So it is always better to get a consultation done.
Okay. Yeah, doctor, if you could speak more closely to the mic, so then you will be more audible, I think.
Yes, okay.
Yeah, because then it will be a little difficult for parents to understand. So if
Yes.
you could be just a little bit closer to the mic, that would be great. So now, yes, so that is what your advice would be, that the skin does change when the child is growing up. But if you find that there is some abnormality, you should definitely go and consult a dermatologist and take his opinion and advice. Yes, thank you, doctor. So, parents, please do keep in mind that when you find anything wrong with your child's skin, don't ignore it. Maybe it will be nothing, or it could be something. So, please do go to the doctor. So, one more problem that teenagers normally face is that they get acne and pimples on their face. So, can you explain in simple words what is acne and what is pimple?
So acne is basically a physiological change. So everybody every now and then gets acne. So all of us suffer from acne, whether in small amount or in more grievous terms. So acne is a physiological thing. Everyone will have it, but it is important to treat it so that it will not leave the marks and the scars over the face, which will remain there for lifelong. Acne is for short term. That is whenever there are hormonal changes in the body, that will show up as acne over the face. It can occur over back, chest, upper arm. So these are the common sites where you can get red bumps, which will not itch, or usually they will not cause any pain. But only problem is cosmetic, so it will look bad. So whenever there is acne, we should treat it because it should not leave any marks or scars over the face. Because acne will come and go without treatment also, but they can leave a mark which will remain there for lifelong. So it is better to get it treated.
So, do children, there is an age group when we get this acne and pimples, or even children, young children can get it? Is it such thing there is such thing?
So usual age group for developing of acne is 15 to 25 years of age. That
Okay,
when
okay.
as the puberty comes up. Puberty is the phase when the hormones in the body shot up and
Mhm.
differentiation between male and female takes place. So in this period, it is very normal to get acne. But sometimes you can get it in otherwise also. That is, you can get it in a infant also, that is below 1 year of age. It is called as infantile acne. So it usually happens due to hormonal changes in the mother. It is maternal hormones will pass on to the baby during the process of delivery, and after that baby may have it, and it will usually subside by the age of 1 year.
Okay.
Also, we nowadays we see that acne, the age group is coming down. That is even 10 years, 8 years, 9 years, children also get acne. So this is due to the changing lifestyle. So more of milk products, more of refined products, sweets. This
Hmm.
can give rise to acne even in younger age group.
Okay.
So even the age of puberty, starting of puberty is coming down due
Oh,
to
yes.
our lifestyle. So we are seeing more of acne in younger age group nowadays.
Okay.
So even if the child is young, we can treat it very safely. We
Hmm.
have now various options to treat the acne, and we can treat it very effectively. So whenever the child gets acne, it is better to get it treated rather than leaving it as physiological, because the as the age passes, the acne will decrease, but the marks and scars will remain.
Okay.
So it is always better to get it treated.
Okay. Yes. So the you're saying that the acne can appear nowadays. It is appearing in children as young as 10, 9, 8, and it can be treated safely. Okay. So there is one parent who has asked a question. My daughter is 3.5 years and has very dry skin that causes her a lot of itching, especially on stomach and back. Due to this, sometimes she scratches herself and it leaves black marks on her body. What can be done to get rid of these marks?
So this question raises a very important issue, that is dryness of the skin. So it is very common nowadays in children to get a dry skin. Majority of the times, it may be some products they are using, the soaps may be harsh, or it can have a congenital dry skin, or it is called as atopy. So atopy is one thing where the child has dry skin throughout, and dry skin is more prone to different types of allergy. So simple dust or dust mite or any of the normal things may give rise to allergy in this kind of children. And they will scratch, and scratching gives rise to marks. So simple thing to prevent this is use a milder soap. So soaps, we have now very different kinds of soaps that are available in market, are being advertised. So it is better to use a mild soap. Meaning of the mild, the pH of the soap is usually should match the skin pH. The normal pH of the skin is 5.5. So we should choose a soap that is around 5.5 pH, and it should be mild or grade 1 soap. So meaning of grade 1 is the total fatty matter that is containing in the soap that should be more than 75%. So this kind of soap should be used, and also regular use of moisturizer is again important in this dry skin issue. So again, variety of moisturizers are there in the market. Some are advertised, some are over the counter. So while choosing a moisturizer, one should remember that it should not contain any fragrance, any color. It should be preferably white, and also it should contain some basic ingredients that we must look out for. That is white soft paraffin and liquid paraffin. These are the basic ingredients of any moisturizer. These two should be there, and this moisturizer should be used throughout the year, not only in winter. Winter you should use always, but also in summer and rainy season also. So throughout the year, you should use the moisturizers.
Okay, so that means you're saying that the soap should have what kind of pH? Can you repeat that again? 5, you said, right?
Yes, 5.5 is the ideal pH, because
5.
that is the pH of the skin. So most
And
of the soaps that are available, that is commercially advertised, they are on the alkaline side. That is the pH is more than 7.
okay.
So they cause dryness of the skin and then other problems of the skin.
So they are easily available in the medical store.
Yes, yes, yes.
And moisturizer should be used throughout the year.
Yes,
So moisturizer should be not have any fragrance and it should be white
yes.
and
Clear
it
skin, non-colored and non-fragrance.
and you said liquid paraffin, right, doctor?
Liquid paraffin and white soft paraffin. These two are the basic and the safest ingredients. So more the contents, nowadays they come with variety of these fancy contents are added to moisturizers. So basically all these are not needed. Sometimes some vitamins are added, some other cosmetic ingredients are added, fragrances are added to feel good
Mm. So we
moisturizer.
should avoid that.
We should usually avoid that. Only this whites of paraffin and liquid paraffin, these two should be there.
So I hope parent that answers your question that the soap should be of 5.5 pH and use moisturizer throughout the year, which should not be white and non-fragrant, and it should have the paraffins as well, liquid paraffin. So we have one more question from a parent saying that she has a daughter who's 8 years old and has dark neck. So what is the reason and what can be done to treat it?
So again, this is a very common problem that we are facing nowadays. So earlier, what used to happen is that we used to get deficiency dermatosis. That is due to deficiency of some vitamins or other ingredients. We would get some skin problems. So nowadays, we are all cautious about the food and all. So we are giving best quality foods containing everything. But now we are facing the problems of excess. So whatever she is saying mostly is blackness of the neck indicates what is called as acanthosis nigricans. This is the terminology used. So this we are seeing in more and more number of children. So children, their weight is above their normal age for that weight. They are getting obese, and due to this weight, there is blackening of the neck. Sometimes it is also under eye and over the face also. So they have chubby cheeks and they will get darkening under the eyes and over the neck. So this is nothing but due to excess of the calories or excess of intake that they are taking, and this results in this so-called acanthosis nigricans. That means blackening of the skin.
Okay, so what can you do to resolve it? Any suggestions?
So only diet modification is first needed. We should not give more of refined foods, sugar-containing things, chocolates, or bakery fruits. And also you should engage the children in physical activities,
Physical
into
activities.
the playground and playing actual games rather than mobile games or watching TV. So due to this corona and all, these indoor activities are increased, but it is now showing its effects in form of this, that is blackening of the neck, children getting obese, getting more of weight. So this is due to the process called as insulin resistance. Insulin is one hormone in our body which maintains our metabolism, and sometimes due to this increased weight or fat content, there is insulin resistance. So this manifests as blackening of the neck. So you should get some diet modification, reducing the calorie intake of the child, more of raw food, vegetables and fruits, and less of refined food, chocolates and confectionaries you should avoid, and engage in more of physical health. So there are creams which can be prescribed only after seeing the patient, but this basic modification should be done before going for actual treatment.
Okay. So more of exercise and outdoor activities, playing around, and rather than sitting at home, or and diet modification. No, means more less chocolate, sweets, and less refined food. So that would be before you go to the doctor. You can do this, and then if it doesn't happen, still it's persisting, then you can go to the doctor and show it to her or him. Show it to the doctor, right?
Right.
Okay. So there's one more question. What do we do for eczema and the marks left on entire body due to scratching? So first, would you explain, doctor, what is eczema, and then we can answer the question.
Yes. So eczema is a condition which is caused due to dry skin. There is thickening, blackening, and the development of patches over the skin. Most commonly, it can occur over the legs, lower legs, and also over the hands. So most common type of eczema, whatever we see in children, is mostly called as atopic dermatitis or atopic eczema. So again, it is very common due to dry skin. It may be congenital dry skin, that is from the birth itself, or it can be acquired due to use of products, soaps, or some other thing. So basic intervention needed is use of moisturizers, as already said. we should apply the moisturizer daily, 2 to 3 times, and it should be continuously applied throughout the year. And basic contents that I have said, liquid paraffin and white soft paraffin. So this must be present, and this will prevent the dryness of the skin, and ultimately it will prevent the formation of eczema. And also, as you go on using them for longer time, these marks and also can be reduced. There are some medications that can reduce the marks, and they can be only given after examining the patient.
So first we try the moisturizer, and even if the dark marks are not going, then we can go to the doctor and get the medicine prescribed for that.
Okay.
So yes, so moisturizer is the ultimate method for removing the dark black marks that are left after itching on the skin. So first you try that, and then if anything doesn't happen, then we can go to the doctor to get it resolved. Okay, thank you. So I hope this answers the questions that we have been asked, the parents, and we have some more questions that had been asked in advance by the parents. Um, now, previously there was this social stigma attached with that white patches which come on the skin. I think it's vitiligo,
Yes.
if I'm wrong, if I'm not right. I mean, if I'm not wrong, sorry. So, I mean, how does it happen? Is it hereditary? And can it be passed from mother to child? And is there any treatment available? These were all the questions regarding that.
Yes, ma'am. The vitiligo is an acquired condition. That is, after a few years of life, the patient or the child will start getting white patches. So, if not treated, they can increase, they can spread all over the body. Mostly, it is not hereditary. Only a 5 to 10% of the people may have family history in the form of either parent having these white spots. In most of the people, that is more than 90% of the people, it will start de novo. That is, the patient will have it, but his neither of the parents or grandparents will not be having such a disease. So it is a disease which is having a great social stigma. So always the parents who come to us are always worried about this vitiligo. So any white patch over the body, so they will rush to the doctor to show it, and they are afraid that whether it is vitiligo or something else. Whenever we tell them that it is not vitiligo, it is something else, then they are happy that okay.
Happy.
So they are happy. So not every patch is a vitiligo. There are a number of causes which give rise to white patch over the skin. So most common that is over the face, over the cheeks. So most of the children, they will get whitish patch which is round in shape. It is mostly over the cheeks or over the forehead. So it is called as the Pityriasis alba. So it is again a type of endogenous eczema, and it has nothing to do with vitiligo. Only some hypopigmentation or decrease in the color of the skin will be there, and sometimes itching may be there. So it is called as Pityriasis alba. It is basically a harmless condition with the simple medication. It can go, and it is not related to vitiligo. If it is a vitiligo, then all the color, that is the pigmentation in that area, will be gone. It is the milky white or chalky white appearance will be there of that patch. So if it is any patch looking like that, then you must get a consultation. So nowadays we have very advanced treatment options for this vitiligo. So we can treat it very effectively if it is diagnosed at earlier stage. If we wait or if we try alternative medicine for some months, years, then it may go on increasing. But the right treatment is given at the earliest time, then we can treat it 100%. So there is a treatment available. We should approach a dermatologist who is qualified enough to treat the disease and get it treated at earliest, because wasting of the time will lead to spreading of the disease, and more the spread, the more time is required to recover that area.
So vitiligo is not something which is hereditary, but it can be treated. And now, because of modern medicine, many treatment options are available to us, and we should definitely treat it at an early age. So it is not happening that the baby is born and then with that vitiligo or something, like it appears maybe after 4 or 5 years,
Yes,
or
there is no fixed timing
it
as
can
per.
happen anytime.
It can happen anytime. It can happen in middle age. It can happen in old age. But usually it is not present at birth. After say 1 or 2 years, it may
Okay.
develop.
So one parent has asked that is it important to put sunscreen on my child when when he is going out to play? Do you need
So
to put sunscreen every time?
yes, so this is again a debatable area whether to use sunscreen or not. So orthopedicians they will advise not to wear a sunscreen. The dermatologist will advise a sunscreen. But according to the latest guidelines, sunscreen usage is required for children. Say about 3 years of age, the sunscreen should be used, and it should be physical type of sunscreen. There are two types of sunscreens basically: physical and chemical. So chemical are to be used in the adults, and physical sunscreens are preferred in the children. So you should basically avoid the timing which is there for the playing of children. So basically harmful rays of the sun which are coming to the earth, they are most common between 10 a.m. to 4 p.m. So whatever your activity is, outdoor activity, playing, swimming, or anything which is to be done outdoor, you should avoid this timing, that is 10 a.m. to 4 p.m. So in this time, majority of the damaging rays are coming to the earth. So we should avoid that timing. Apart from that timing, you can allow your child to play outside. And wearing the sunscreen is also recommended nowadays because whatever sun exposure, tanning, or whatever the aging effects or the harmful effects of sun rays, these are seen. So majority of the lifetime sun exposure that is done before 20 years of age. So because at that time we are not very cautious about the sun, and we don't know whatever is happening, what damage is done by the sun ray. So majority of sun exposure that occurs is within 20 years of life. So nowadays it is advised that above 3 years, all persons who are having outdoor activity should use a sunscreen.
So what should be the SPF? Any guidelines on that?
Yes, again, in India, we are a tropical country. So most of the 10 to 11 months, we will get a bright sunlight. So throughout the year, we are having sunlight. So sunscreen should also be used whenever there is outdoor activity. And the SPF factor, which is recommended in India, is 15 to 30 SPF. So 15 SPF for body, that is hands, neck, etc., and 30 for the face. So usually any sunscreen that is claiming 30 SPF is sufficient enough for children. So 15 to 30 is the range.
Mhm.
The more the SPF, better is the protection.
Okay. So definitely we should use sunscreen and avoid going in the sun between the timings of 10 to 4.
Mm.
After that you can go, but it's advisable that you put the sunscreen and go, and it should be in the SPF, it should be 15 to 30. That is the recommended SPF. That is what you are saying,
Yes.
right? Okay. So this question is from a new mother. She is like, do I have to bathe my child every day? Is it necessary that छोटे बच्चे को रोज नहलाना है? Can we skip one day because now it is winter and it's cold and maybe he will get cold or fever or something like that. So all these doubts are there in a new mother's mind.
Mm. So unless it is contraindicated or told by a pediatrician to not to bathe the baby, it is always better to give daily bath. So even in fever also, they will suggest some wet wipes or the bathing of the baby. So it is always better to take daily bathing is advised usually.
Okay. So daily bath is advised, and unless the pediatrician says that please don't give him a bath every day.
Yes.
So is the case of skin cancer increasing in India? And is it possible children can get it as well?
So skin cancer, whenever we say skin cancer, there are two types of cancer. One is melanoma and other is squamous cell carcinoma. So these are usually due to harmful rays, that is UVA rays of the sun, and these rays are usually more prevalent in the some countries, that is Australia and New Zealand. So the cases of these cancers are more in there. So in India, we are skin of color, so we are pigmented. We are not as white or as fair as the North, this European skin or the Australian skin. So we are less prone. This pigmentation or the melanin which is present in the skin is protecting us from the harmful rays of the sun. So skin cancer is not common in India actually.
Okay, it's
It's
not
more
common in
common in
India.
the white skin and Australia, New Zealand, where the
It,
ozone layer of the this atmosphere has thinned out. It has holes. So
okay.
in that places, they are having more cases of this malignancies of the skin. But in India, we are saved due to our skin
Mm-hmm.
color.
Mm-hmm. So there's this question by a parent. Newborn acne, how much time it takes to resolve and is treatment necessary?
So usually newborn acne, the treatment is not necessary. As soon as baby is born, he will develop some acne. But when the effect of the maternal hormones that fades away, that is around 4 to 6 weeks, this acne should disappear.
Hmm.
Sometimes, if they persist beyond this 6 weeks period, then sometimes treatment is needed. Otherwise, it is a self-limiting condition, and the acne will go on their own. So no treatment is required.
So it resolves on its own. So there's no special treatment required in that. Right. Doctor, there's one more question who parent has asked about psoriasis. Have I pronounced it correctly? Psoriasis, right?
Yes, correct.
Okay. So what it is, and does it? I mean, how do we know that whether my child is having it, or it's just? I mean, what it is exactly? So.
Psoriasis again is a common condition of the skin. So approximately 1 to 2% of the population is having psoriasis at any given time. So in our country of 130 crores, approximately 3 to 4 crore people are having psoriasis. So it is a very common condition. So apart from cosmetic purpose, it is not harmful. It will not damage any internal organs or the progress of the body. So children can also get psoriasis. Most common form of psoriasis we get is chronic plaque psoriasis, that the child will have scaly elevations over the skin that will be over the elbows and knees and sometimes over the back. So this is the most common type of psoriasis. It will appear as red patches which will have silvery scaling over them, and they can occur over the scalp also. And sometimes the nails may get colored like yellow color or black color. So these are the common sites of psoriasis: scalp, then extensors like elbows and knee, and lower back. So these areas will develop scaly plaques and they will not go away; they will remain there. Again, this is a chronic condition. Chronic meaning it will run into months or years. Some patients may go into remission, that after treatment they will not get it for a few years, say 10 years or like that. But again, there is always a possibility of recurrence. So psoriasis is a common disease in adults as well as in children. Both can get it. So if you suspect any child or your child is having like that, then you should confirm with a dermatologist what it is. And nowadays, treatments are available for psoriasis also. Very good and safe medications are available, which can treat the psoriasis very effectively and keep it under the check. So, first step would be to get a consultation with a dermatologist.
And can you elaborate on any hair diseases that children can have? Hair related diseases.
So, hair related diseases are also nowadays seen in children. Previously, they were not that common, but nowadays, most common complaint that we get is graying of the hair. So few and two or few of the hairs, these are going white. So that is again common. Then we get what is called as alopecia areata, that is patchy loss of hair in the scalp. So one fine day you will find that there is a patch inside the scalp where the child has lost all the hair. It is rounded, well rounded, and there are no hairs in that patch. So it is called as alopecia areata. And then again, this dandruff or seborrheic dermatitis, that is again common in the children. So that is again starting at puberty, but nowadays we get at lower age also. So these two, three things are common: graying of hair, alopecia areata, and this seborrheic dermatitis or dandruff of the scalp.
So the treatments are available for these
Yes,
diseases, hair diseases, whatever.
treatment are available for graying of hair. Mostly dietary modification is again needed. Same one which we have discussed earlier. Less of refined foods and more of natural raw fruits and vegetables, so that we can get all the nutrients that are needed for hair growth and normal black pigmentation of the hair.
So nowadays we also have skin laser treatments available in the available at the doctor with the doctor. So is it safe for children? I mean, no, not at this age.
So usually it depends on the indication, for what indication you want to undergo. So if the indication is purely cosmetic, that is pigmentation or acne, it is better to avoid below 12 years of age. So as a rule, we don't do any procedure till 12 years of age for this cosmetic reason. If it is for some real reason, like there is a birthmark or disfiguring thing over the face, which can hamper the confidence of the patient or the child while going to school and facing the community. So at that time, the treatment is needed, and that can be done with the laser. That can be done at earlier age also.
Mm-hmm.
So if the indication is purely cosmetic and not of much trouble, then it is better to avoid till 12 years of age. If the thing is growing, the cosmetic or any birthmark is in growing stage or it is disfiguring, then it is always better to get it treated.
So, doctor, we have covered all the questions that have been asked by the parents. Okay, just 1 minute. I think there's this question. Okay, is coconut oil good for child?
So this is a good question actually. Coconut oil is very good for children. There is no problem, and you can use it as a moisturizer also. It contains medium chain triglycerides, so these are good for the skin. As a routine also, you can use it for child skin and also for oiling the scalp. More of oiling is not indicated. Once or twice a week is sufficient for the hair. So daily oil application to the scalp is actually not recommended, but once in a while you can use. And as a moisturizer also to the skin, you can use the coconut oil. There is no problem.
Okay. So cooking food in coconut oil is also good for children. So that doesn't make any harmful. It's not harmful. I mean,
Yes.
normal cooking oil for in coconut oil. That's
Yes.
what we wanted to know. Because in some parts of India, they do use coconut oil while cooking food as well.
Yes. Yes.
Yeah. So, doctor, I think we have covered all the questions that were asked in advance by the parents as well as during the session. So, would you like to give your concluding remarks as to what skin care for young children should be to the parents before we finish the webinar?
Yes. So basically, below 10 years, children should not use any of the cosmetics, any creams, lipsticks, or any cosmetic products. That all should be avoided. Then daily bathing is essential. Daily moisturizing with good moisturizer is essential throughout the year. And whenever there is outdoor activity, prolonged outdoor exposure, then sunscreen usage is also recommended about 3 years of age. Then use of mild soap is again important. So any soap which is having grade 1 soap containing total fatty matter more than 75% is good for skin. And protective clothing, good physical activity is So skin health is not only about the skin; it is a general health of the body, which is showing in the skin. So general health of the body should also be maintained for good skin.
Thank you, doctor, for your concluding remarks. So, parents, we have to keep in mind that we avoid fatty, refined foods, sugar intake. We reduce the sugar intake of the children, make them more involved in outdoor playing activities, and use the sunscreen while you are playing, while the child is going out to play. And some of the simple tips, if you keep in mind, your child will definitely have a healthy and glowing skin. So, thank you, doctor, for giving your valuable time and answering all our questions very patiently and giving us very nice inputs as well. Thank you very much. And thank you to all the parents and the attendees who attended the webinar. And we will see you next week for another new webinar and another new topic to discuss. Thank you, doctor. Thank you very much.
Thank you.
Bye bye.